As mentioned by Michael, two Indonesian startups joined the academy, and one of them is Paperless Hospital. We are now connected with the founders of Paperless Hospital, Tri Wahyudi. Tri, thank you so much for joining us.
Thank you for having me to join this program. Thank you, see today.
All right. So, as a healthcare startups, what are the challenges that you are facing, and how does AI help you to overcome these challenges?
Yeah. Based on my 7 years experience as an IT consultant in hospitals, I see that so many doctor and nurse that focusly to administration form, then to facing the patient. That's because the administration form is very important for them to fulfill all the clinical documentation caused by mandated by the government to insurance administration. So I see that so many our medical worker burn out because they must fulfill all the documentation outside the hospital in their home. They call it homework to fulfill all documentation forms. So we try to helping the burnout situation from this medical worker, doctor and nurse to focusly facing the patient, focus to administration form by change the conversation between them by AI from voice to text, and then our AI will analyzing the data and fulfill all the documentation job. So they focusly to serving the patient, not focusly to administration.
Oh, that sounds.
So that's why. Yeah.
Sorry, go ahead. So that's why.
Why? Because in Indonesia, one doctor can serve more than 30 patients in a day. So if administration form giving them time about 5 minutes, imagine how they can fulfill all this documentation job. So most of them feel tired and burn out, and they cannot focusly to patient care. So every minute they focus to administration, actually every minute they lost to patient care. So we want all of our medical worker focus to serve the patient, not focus to administration form. So that's we create AI medical scribe technology.
That sounds great. It sounds like what all those mundane tasks that they have to go through. Now you're taking that out, and then so they can focus more on attending their patients, and then that will help so much better, especially for the patient itself. That sounds great. Can you give us an idea a little bit? So does Paperless started as an AI company, or how you guys all started? Like, is that what was your goal to begin with?
Yeah. First of all, actually, we focusly to serving the programmer on site. We are EHR operator for the first time, and then we see that the problem of medical worker in Indonesia just not about the EHR system or medical engineering documentation, but the situation is because they're mandated to fulfill documentation of medical record. One patient, they have to fulfill about 7 forms. So most of them get burnt out caused by this clinical documentation job. So in 2022, we focusly to using AI, and then we try to change the voice to text technology, and then we serve all our 14 hospitals as our client to using this our AI. More than 300 doctor and more than 700 nurse has been using our AI today, and more than about 300,000 users per month, patient per month, that has been more happily because the doctor and nurse more focused to speak with them, not by documentation and typing or see the screen computer.
Yes. Yeah. That sounds great. Now, I'm sorry, I have to ask you this. So, you know, Jakarta is very developed hospital competing with their IT, and like a lot of startups in here actually working with some doctors or some hospital on their devices or some of their technology. But one of the things that we noticed here in Indonesia is, you know, when we go outside of Jakarta or Surabaya or all the big cities, we find these problems will become more and more prominent. So do you have a way with this AI to tackle those problems, or like how do we face these challenges for Paperless Hospital?
Yeah, actually, you know, most of hospitals in Indonesia right now very crowded, caused by national government insurance model. So and also the lifestyle of Indonesian people maybe still must to upgrade to be more healthier. So this crowded situation make all the servicing process to be complicated, right? Just not in Jakarta and Surabaya, some of our clients in Kalimantan, some of our clients in Aceh, they also very excited to using this AI because this is something new for them. And in one side, it helping them to not in burnout situation. They can focus to talk with the patient, the medical worker, and then the patient feel more happier because the doctor more focused to facing them. And this is, I think, will be the opportunity for right now and for the future. Yeah, AI will be the game changer. But as a technology team, I think AI must focusly to serve to reduce all the administration form. So all the patient care is focusedly to serving, not the administration process. That's our target for our AI. And maybe then AI will go to diagnosis or something like that, but that will need process, I think. So right there, that's my answer. Thank you.
All right, so you joined the AI Academy of APAC, which is congratulations. You one of the only two from Indonesia so far right now. So what did you learn through the program and what attracted you to actually join in the first place?
Yeah, I think I'm very grateful to join with Google IPAC program. It was really incredible experience. We're talking about the newest technology right now, how the other countries using Google technology. We also have opportunity to explore the internal technology from Google like Gemini, Vertex AI, and that's increased our capacity in AI incredibly. So I'm very grateful for joining this program. We also talking about how we focus to concern about the privacy of the patient. Google very concerned about that. So I think it was a very good experience for me to know about the privacy, how to save the patient. The information must be very credential. And then we also get the new team, new networking from another startup around Asia Pacific. It was very incredible experience for me. So thank you, Google. Thank you, C, for all of this grateful experience. Really passionate about it.
That was interesting that you mentioned about the privacy of the patient. That's very important. And then like sometimes we forget about those importance. Now, what kind of business development? What kind of business development can one expect after joining a training program like the AI Academy APAC?
Yeah, I think number one is the opportunity for us is to increase our technology like accuracy. You know, before joining the Google program, our accuracy is still in 91%. And because joined by the program, we upgrade the technically of our engineer, and now we have confidently to say if our accuracy increased to 94%. It's 3% more powerful to accuracy. It's very good and very grateful for us. And then also we learned so much about how to manage the business. This is a business, so the team must be very lean, and the management must be very professional. And this program will giving a very good impact for a founder like me, and technically also very good impact for the technical team. So I'm very recommended program like this to all of Indonesian startup enthusiasts. Join with this program and get the opportunity.
All right, Tri, before I let you go, one last question. The next 5 years, how do you see AI will impact the hospital business, or how the paperless hospital gonna look like in the next 5 years?
I think number one, most of the healthcare industry will using AI, because healthcare industry that using AI will to be the winner than the healthcare industry that not using AI. That's my perception for 5 years later. So. And then, how about paperless hospital? We will grow to Asia Pacific. That's our plan. And by help by Google networking and Google mentoring, they also advise for us to increase our capacity and increase the country that we can serve. And we hopefully AI will help so many souls in the world.